Hi, my name is Dr. Narayanankutty. I am Medical Director and Senior Consultant at MVR Cancer Center and Research Institute, Calicut, Kerala. October is Breast Cancer Awareness Month being observed throughout the world with a lot of activities to create awareness about breast cancer. Why about breast cancer? Because breast cancer is the commonest cancer seen in women, especially between the age of 40 to 55 years. But awareness about breast cancer is very much lacking, and many times people are coming at a very advanced stage. So when you are diagnosed with an advanced breast cancer, the chances of getting a complete cure is very remote. So how to make one aware about early detection of breast cancer? It is by continuous education and spreading the news about the symptoms of breast cancer and who all will get breast cancer and what are the risk factors for breast cancer. So now let me tell about the symptoms of breast cancer. There are certain warning signs about breast cancer, like a lump in the breast, or a change in the skin of the breast, or a retraction of the nipple inside, or even lumps in the or swelling in the armpit, or swelling of one of the arms. So if you have any of these symptoms, or in addition can be discharge from nipple. So if you have any of these symptoms, please consult a doctor. Then how to do a breast examination, or how to go for a early detection? Early detection is by doing a screening program. So for screening we have three methods. One important method, probably the best method, is self-examination, self-breast examination. If you look at or if you Google how to do a breast self-examination, you can find a lot of information. I am not going to the details of breast self-examination, but I'll tell you one very effective method of detecting breast cancer early is self-breast examination. This you can do it every month, especially after 6th day or 7th day, before 12th day of your starting day of periods. So this you start doing from 20 years onwards, and then yearly a mammogram. A mammogram is nothing but an X-ray of the breast. So start doing X-ray of breast after 40 years, and you can continue till 60 or 65. So during every year you do a breast mammogram, as well as every month you do self breast examination. You can detect breast cancer even at before cancer develops a lump in the breast. So who should be going for screening program? Anybody above age of 40 years, any woman above age of 40 years, and before getting any symptoms. So you needn't wait till you get symptoms, then it can be an early detection. So screening is something you voluntarily go for examination every year, and the screening is done by yearly mammogram. Then coming to what are the risk factors? The risk factors, as all of you know, this is a hormone dependent cancer. Breast cancer is highly dependent on hormones. So any fluctuation in the of hormones taking place in the human body, especially between the age of 15 to 50 years, this is the time or during this the life cycle of a woman having menstruation is the biggest risk factor for developing breast cancer. So any women between 15 years and 50 years who are having menstruation will be at high risk of developing breast cancer. The reason is the breast cancer is a hormone dependent cancer, and the more you get menstrual cycles, the more will be your chance of getting breast cancer. So we can look at in a different way, like previously in olden days a girl used to get menarche by the age of 15 years, but now the girls are attaining menarche even before the age of 8 years. So about 7 years before the expected time of menarche is one extreme, and the other extreme is like the women generally gets menopause by 45 years, but nowadays people are getting menopause or attaining menopause by only by 52 or even 55. So another 7 to 10 years of extension of menstrual cycles during the between 45 and 55. So in general women will be having 15 years above or more of menstrual cycles in the body. So more chance of getting hormonal fluctuation during this time, this period, and thereby they are at high risk of developing breast cancer. The second issue is the one of the important factor is the age at which women going for childbirth. The first childbirth, the safe childbirth, is between 25 and 30 years, but unfortunately many women are employed nowadays, and they all often postpone their first pregnancy beyond 30 years. So that makes them higher risk for developing breast cancer, because when you are postponing first pregnancy beyond 30 years, there is a possibility that there are hormonal changes taking place in human body. So these two are the main reasons why there is an increase in the development of incidence of breast cancer. Now, what are the causes of this early menarche and or a late menopause? Early menarche is very often related to the physical activity as well as the diet the children take during the early childhood. So if you look at the current scenario, you can see that majority of our girls are not playing, not physically active, and they are all sitting in front of TV and or the computer games, and they have a very sedentary lifestyle. So that makes them that induces early menarche. And very often they are very much stressed because of the studies and the stresses involved in a nuclear family. So this makes them attain menarche at an early age, and thereby they are having starting menstrual cycles 7 years prior to the usual expected year. If you look at the menopause, they are all attaining menopause or continuing menstruation even beyond 50 years, and sometimes the menopause is attained by 50 years. So there is a further extension of menstrual cycles, and thereby at a higher risk of developing breast cancer. And why they are having or continuing menstruation even after why they are getting a late menopause? Reason is simple. They are all at a very high or stressed mentally, as well as they are not having enough physical exercise, and also in the middle age they are all having a craving for food, and they all get or gain lot of weight and fat deposition. And you know the hormones, especially the female hormones, are stored in fat, and if they are obese, they are at higher risk for breast cancer. So these are some of the risk factors which are very often forgotten or not given adequate attention. And I request all of you to listen to this risk factors, or see to that your children are playing physically, as well as they are not at mental tension, and make sure that your child is doing physical activity, and thereby you can postpone the menarche to beyond 12 years, or if possible to 15 years. You can push it to 15 years. That will be an important factor, important step towards preventing breast cancer. And if you look at the again, how to prevent, or how to prevent the menopause, how to attain the menopause at an early age, is by again doing some physical activity towards the 50 years middle age, and also taking less fat, and keeping a lean body weight. So these are some of the tips which by which you can prevent breast cancer. Now, the early detection I have already mentioned. Now the treatment part of breast cancer is very impressive. Though the incidence of breast cancer has gone up, and the mortality is reduced like anything. The reason being, because of the continuous awareness and screening program, breast cancer is detected at a much earlier stage, and luckily we have very good treatment available for breast cancer. And the important aspects of the treatment are: one is surgery, second is chemotherapy, and third is radiation. And nowadays we don't have to sacrifice whole breast for treatment. We can remove the lump alone, and thereby you can preserve the breast. And also some of the plastic surgery procedures we undertake even at the time of primary surgery, make them very much aesthetically, or they can they will not it will not vulgar your body image at all. So that's one area, one improvement in breast cancer surgery. And depending upon the behavior of breast cancer, we can offer them good chemotherapy, as well as the very targeted treatment also is available. So the advances in chemotherapy, as well as advances in the targeted agents, we can really curtail the spread of cancer, and thereby we can achieve good control. And the radiation techniques have really improved. With the new radiation techniques, we can even treat breast cancer without causing any damage to the underlying structures like lungs and the heart. So we have improvements in surgery, we have improvements in chemotherapy, and we have improvements in radiation, and thereby the treatment has become very simple and without much side effects, as well as efficacy wise it is much better compared to the previous treatments. The one important advances is probably the deviation from the conventional chemotherapy. Many times we can offer treatment without any chemotherapy, especially when they are diagnosed at an early stage. And the very recent update on breast cancer says a good number of patients can really avoid chemotherapy if the breast cancer stage is the early diagnosis made early, and if they have certain the surgical pathology says that they have only a very early stage of disease and their lymph nodes are not involved, and they are positive for hormones, that tissues are positive for hormones, and they don't have any other bad or high risk features, they can be treated with hormones alone. It's an important step towards avoiding chemotherapy, and this is made possible because of the advent of newer diagnostic tests like gene methods. You analyze the gene and find out what is the risk score, what is the risk of a lady getting relapse at a recurrence later. If the recurrence score is less than or less, probably such patients can be taken for treatment without chemotherapy. So in all aspects we have made a lot of advances. We have made advances in diagnosis, we have made advances in the treatment, various aspects including surgery, chemotherapy and radiation. So the only thing we still require is wide awareness. So use October for creating awareness among all your relatives, and as well as the whoever is coming across you. Tell them that breast cancer is a lifestyle disease which can be prevented by modifying the lifestyle. If not able to prevent the breast cancer, but at least you can detect them early by using the breast self examination as well as screening methods like a mammogram every yearly mammogram, and we have very good methods for treatment. Thank you for your attention.